Hello everyone. So today we will be talking about anatomical snuffbox. As let me share the screen and let me take you here. As you could see, in anatomical snuffbox, I want you to have a look here. For the sake of borders, all right, this is the best image as I can. Yes, view image. Have a look. Right, if you are looking at the image, three muscles are right in front of you, and this is the back of the wrist, and it's the dorsal aspect of the wrist. This is the extensor retinaculum, and you can see in the synovial sheath here is extensor pollicis longus, and this is extensor pollicis brevis, extensor abductor pollicis longus, this third muscle. So if I tell you this space over here, this is called anatomical snuff box. And if I tell you it's bordered, as you could see, you can see by the tendons of abductor pollicis. This is abductor pollicis longus. Here, the most lateral muscle, and then extensor pollicis brevis, extensively, and medially extensor pollicis longus. So these are the two lateral muscles, and this is the medial muscle. And what I can tell you, this can be treated at the base of the terminal phalanx of the extended thumb, and these tendons of extensor diastrum are, you could see that in the extended hand, these are passing by, and this is from the Google Teach Me Anatomy picture, and you can see they pass to the proximal phalanx. You can't see in this image. I'll try to show you over here. Yes. So this is the surface anatomy. If you could see surface anatomy of the anatomical snuff box. These are the important structures that you should be knowing about. If you could see, have a look here. This image actually tells a lot, and you have to know this image. And if you are looking on the left hand side, so extensor pollicis longus to the base of the distal phalanx, that's where it attaches. Extensor pollicis brevis to the base of the proximal phalanx, it's this one. And this is the anatomical snuff box. At the base, you could feel trapezium and scaphoid. Here, you could feel the trapezium and the scaphoid. And abductor pollicis longus, which is inserted to the base of the first metacarpal. In here, you will see cephalic vein, the formation of cephalic vein, and then moving on. This is the superficial branch of the radial nerve. This is the radial artery, right? This is the radial artery, and it's lying on the scaphoid and the trapezium in the anatomical snuff box. Here, if a person falls on outstretched hand, can have tenderness at this region, and it's very important that if you do x-ray right away, you may not be able to see the fracture or dislocation of the scaphoid bone, which forms the base or the floor of the anatomical snuff box. So it's very important to take the tenderness in anatomical snuff box seriously. Follow the patient, put the patient in the splint, anatomical snuff box splint, and follow the patient up, and then maybe after 2 weeks if you teach your X-ray, you'll be able to see the fracture. Why the fracture of scaphoid bone in anatomical snuffbox is important. This is very important, you have to tell me. Because as you could see the radial artery, it's supplying, here it is, okay, have a look. And this is the scaphoid bone. So when it supplies from the proximal side, so that it supplies to the, it does not supplies to the distal part of the scaphoid. That's why if there is fracture, this distal part of the scaphoid can go into avascular necrosis. There could be avascular necrosis of the scaphoid or of scaphoid bone. So that's very important to know. And patient can complain of persistent tenderness, persistent pain while doing several movements of the hand, especially gripping or, yeah. So these are coming back to the image. Have a look at this image. Yes, let me enlarge it for you. This is again anatomical snuff box, all summarized in a nutshell, you could say. These are the borders. Oh, very good. I've enlarged it. Now you can have a look at it very carefully. The borders, once again, medially extensor pollicis longus tendon, laterally extensor pollicis brevis, and abductor pollicis longus tendon. Proximally, scaphoid process of radius, and floor carpal bones like scaphoid and trapezium. We've already covered that, right? And the contents, very important. It's radial artery. See, have a look. Radial artery, superficial branch of the radial nerve, and the cephalic vein. You could see all these. These are the three contents. So this is the first dorsal interosseous muscle. Have a look over here. This is the radial artery. You can feel the pulse of the radial artery in the anatomical snuff box if you press it against the scaphoid bone. So these are the tendons. This is the cephalic vein formation. And this is the anatomical snuff box. Yes, very good. All right. So keep revising, keep reading. Tomorrow we'll discover or we'll discuss more about the scaphoid bone fracture, dislocation of the lunate bones, what other carpal bones can cause pain in the hand or can give discomfort. So basically, all the carpal bones will be covered tomorrow in the next lecture. So until then, keep revising, keep studying, and stay safe and stay good. All the best.